for Leader Professional. I'll go through what's on the agenda on the next slide. But just to say, if anybody is having any problems listening to the webinar, if your signal's not great or you're dipping in and out or whatever, don't worry. We'll send you a copy of the webinar afterwards. And also we can email you a presentation if you like, if you let us know your email address, and we'll send you a copy of the presentation in hard form as well. So as I say, I'm the UK sales manager for Leader Professional. Leader have been selling microfiber systems into hospitals since round about the mid to the end of the 90s. And more recently, in the last few years, care homes have been adapting some of the same methods within their cleaning regimes. I think this year has made everybody focus much more on cleaning and how we are all looking at how we can improve our methods and adapt far more stringent procedures, and also upgrade on some of the tired old traditional methods that simply, frankly, leave a lot to be desired. So this is what we're going to be talking about. Basically, why cleaning in care homes is so important. Why change from some of the old traditional methods that some places have used for years and years, to really sort of dispel the expensive myths around microfiber. Everyone thinks microfiber is very, very expensive to implement. Hopefully I'll show you that it isn't, and it actually saves money. Why the old traditional methods do not work. As I say, why and how microfiber does work, and that it's independently tested also. We'll explain regards to a few of our products, the Leader products, show you some of the evidence and the test data to go along with it. I'll also talk about some of the training and the support that we can offer. And then I'll pass over to our expert on iConnect, which is our management system for cleaning regimes. Is Umar Aftab. I'll pass over him to the last few slides. But that's our agenda. But first of all, some of the horrible cold hard facts regards to COVID-19. Since the beginning of the pandemic, this is between March, 2nd of March and the 12th of June, there were 66,000 deaths of care home residents. And of these, a massive over 19,000 involved COVID-19, which is 29.3% of all deaths of care home residents. And of deaths involving those 19,000 involving COVID, 74.9% were actually in care homes, within the care home, and 24.8% occurred within a hospital. So really horrible, hard facts, and it's as I say, it's been one hell of a. So just to say why effective cleaning methods are so important within your homes, and obviously a clean home reduces the emotional stress for your residents and visitors alike. Anybody visiting just needs that reassurance that your home is lovely and clean, and it represents a very professional company image. And a dirty home, of course, is an infection risk, an infection control risk. It can exacerbate asthma, increases the spread of infections if not cleaned properly, and allows dangerous bacteria to thrive. And also, reducing harmful chemicals can create a cleaner, safer, and more cost-efficient home to run. But there is a potential to massively reduce the cost of the current chemicals and the utility usage, which I'll go on to talk to you a little bit more in depth about as we go forward. First of all, I want to speak to you about a microfiber implementation that we carried out at a home in the southeast of the country. Basically, they wanted to come up to NHS standards for cleaning, and wanted to look at a more effective way of cleaning using microfiber. They'd heard a lot about it from many NHS hospitals, but they wondered if they could really afford such an upgrade. But actually, we showed them that not only they could improve their hygiene more efficiently and be more user friendly to their staff, but they could actually cut down on their current running costs. And as you say in that picture, seeing that picture there, we actually managed to save them over a period of time £14,500. And I'll go on to sort of show you how we managed to do that. And what was their rationale for change? As I said, see the picture in the slide there. That was a picture of one of the trolleys that they were pushing around. Obviously, the trolleys are not lockable, and residents had access to cleaning products and equipment. And the residents were, of a dementia nature, and so making it even more dangerous for taking chemicals potentially off the top of the trolley. The trolleys were very heavy, and you see it's vastly overloaded. And pushing trolleys around on carpet can be difficult, so it was very difficult to manoeuvre, and it was hurting the staff's wrists and shoulders, etc. Also, the traditional mops, the ones you can see on the right hand side, were difficult to wring out, to bend right down. It caused the operators to suffer with again with issues with the backs and shoulders. The current mops that they were using, the mops and cloths that they had, didn't really clean to the required standard, and the standard that they wanted to achieve. The mops used to leave excess water on the floors, and the floors took a long time to dry, which again can cause potential hazards. And there was an increase of productivity of operators because they were emptying buckets of water and filling up buckets of water, which took time. And also, they wanted to reduce the use of chemicals. You can probably just see at the top of the trolley there, they had loads of different sorts of chemicals for this, that, and the other, and they really didn't need that many different chemicals at all. And reduction in chemicals obviously would make it safer for the environment, for the residents and staff. And also, they were looking to reduce costs for the laundry, for the chemicals, and their water usage if possible. Also, as well, if I mentioned the mop buckets that they were using, they had fixed handles, which didn't allow for the different heights of the staff. Some had to bend down a long way, some were reaching up. The ringers were very low down, so they had to bend to wring the mop out. And it wasn't easy to wring the mop out. They had to give it a real big squeeze to get the mop as dry as possible. And the currents, they were actually using a Kentucky mop bucket with socket mops. So the socket mops were actually too small for the actual Kentucky buckets that they were using. And as I said before, some operators experienced pain when wringing. And the worst thing was that they had to push the two different mop buckets, or the red and the blue buckets, around with them on a separate journey to push in the trolley, because they didn't have space on the trolley to house any buckets and ringers. So it was a long, drawn out task. And the fact was, with using sort of single buckets as well, basically means that as soon as you mop a floor, or in particular a toilet, there's no, unless you come out of that room and you change your water round and you change your mop head round, there is nowhere else for that water to go. Sorry, for that dirt to go. It can only go to inside the bucket. So unless you change that water round, all you are doing is moving the dirt from one floor to another. And if you imagine that's a toilet, and I think they were mopping sort of 5 or 6 toilets at a time. So from the dirt from from toilet 1 was going onto toilet 6, and God knows what was lying in that dirt. So infection prevention, as I say, is now everybody's business. And infection prevention looks at all activities aimed at breaking the infection train. It's mandatory in all healthcare sites, and probably more relevant now, it's mandatory really in every site, especially now, and saying going forward. So how to improve infection prevention in the cleaning process. Of course, we need the correct cleaning protocols and methodology. We need to be using the correct equipment, products that mechanically clean before disinfection, and I'll come on later to talk about mechanical cleaning. And you also need regular support from your suppliers and training on how to get the most out of your equipment effectively. And implementing all these actions, can help significantly reduce the spread of infections within your healthcare environment. And current care home cleaning practices and protocols require a step change to benchmark NHS cleaning standards. So what is pre-prepared mopping, which is what we offer here at Vileda, microfiber pre-prepared mopping. It's fairly straightforward. I mean, mops are simply placed into a bucket, like you can see in your picture 3. A sieve is placed on top of the bucket, and then water and chemical, if you need to, and again I'll come on to talk about that, of choice is that's what you want to use, is added through the sieve. The bucket is then placed onto the cleaning trolley, and you're good to go. You've got a separate mop for every area, so you're never spreading dirt around from a single bucket. Every time you go into a different area, use a different mop, so you're using a fresh, clean mop for every area that you go in. So there's no chance of spreading any dirt or potential harmful bacteria around. So this is an example of what the home, how we sort of worked out how much they were spending and how much we could save them. And this is based on a 2-mop rotation. And what I mean by a 2-mop rotation is that they're basically using one set of mops for the whole cleaning process, one set of microfiber mops, and while one set of mops is being washed within the laundry system. And if you look at the table there below, it shows their current usage. What do I mean by current usage is what they were currently spending on their mops, on their disposable cloths, on mop buckets, handles, extra ringers, etc., etc. Also included was dust mops as well. And they were spending just over £4,000 on all those items, but that's every year. So if we take that over the 5.5 year period, which is the 2-mop, which is the time the 2-mop rotation gives you, if you see at the end there, over 5 years, they were spending around about £20,500 in that time. When they've implemented the Vileda system, it basically it came to just over £4,000, round about the same amount they were spending per year on their own consumables. And then year 2, 3, 4, and 5 were just extra cloths that they needed to purchase. But it was, just over £6,500 over the 5-year period. So it saved them just under £14,000 in that 5.5 year period. So a real big saving there. And not only improving hygiene, but also cost savings as well. So whole system saving. I mean, when we implement into hospitals, they usually go with a 3-mop rotation, which means the investment in mops would last 8.2 years. What I mean by that is one mop will wash 1,000 times. So if you've got a 3-mop rotation, you're only washing every 3rd day and only using every 3rd day. So you get 3 times for what you pay for. So you get 8.2 years for a 3-mop rotation. So if you go for a 3-mop rotation, for the price it costs, you're actually saving much more money. So a real sound investment for not only a cleaner environment, more hygienic environment, but also a cost saving also. And we can show you how that happens in your home as well if necessary. The picture on there just shows a hospital that used those sort of traditional old products and replaced them with the Vileda microfiber system. And that was during the height of COVID that we went and did all the training with the hospital there. So it was literally out with the old and in with the new, and you can see that the difference there is stark. It's just so much more professional, so much tidier, complete lockable trolleys, chance for people to take chemicals out and things like that. So yeah, just overall much more professional system. So what are traditional products that are being used, and these are in a hell of a lot of care homes, still, believe it or not, in some hospitals, which does sort of beg a belief. But these are the products. Starting in the bottom left hand corner there, you've got the single Kentucky buckets with the mops, with the cotton mops that we saw in the previous slide. Some places, some hygiene places still use blue roll. Can you believe, for cleaning? Again, no mechanical cleaning method there to be able to get into all the surfaces. Wet wipes, which is the bone of contention for us here at Vileda, because although you're painting a surface with a nice chemical, you're still not getting into those cracks and crevices. And I'll come on to tell you what I mean. That involves mechanical cleaning. Cheap non-woven cloths that just basically push dirt around. Again, they've got nothing within the cloth that will pick up the dirt. Again, they'll spread a chemical or a sanitizer around nicely, but they can't and don't actually clean. The white disposable mops, which is the same thing, and also old traditional cotton mops that we've used for years and years and years, which all they do is push dirt around. They have no mechanical activity within them to be able to clean a surface the correct way. And as I say, I'm going to explain why. So what does mechanically clean mean? If you look at the slide there on the screen, in the top right hand side, you'll see what looks like a smooth surface, but that's under a microscope. And you can see that all sort of apparently smooth surfaces have hairline scratches, cracks, nooks and crannies that over the years get more and more damaged as we use them, as we clean them, with Chlor-Clean or ActiClor or those types of products. They damage the surface. And these may be several microns deep below the surface line. And inside, in those cracks and crevices, nooks and crannies, it harbours things like skin fat, bacterial and virus harboring biofilm, moisture, salts. There just becomes a big buildup of dirt and bacteria that those sort of cheap non-woven cloths and mops can't reach. And you can see in the bottom left picture there, that's the bacteria and the virus harboring biofilm. And it gathers at the base of all these surface defects if mechanical cleaning isn't done regularly. And disinfection without mechanically cleaning the surface would just reach the top layer. It's a bit like using alcohol gel continuously without washing your hands. It's the same sort of principle. You need to be able to clean, mechanically clean, before you can disinfect. So if you look at the conventional types of products that I've just spoken about, like your wet wipes, like your cheap non-woven cloths, cotton mops, your white socket mops, and particularly blue roll, they're roughly about 10 microns in diameter. So each strand, each fiber is about 10 microns. And basically, if you look at this little animation here, this is that fiber going across the surface with all these nooks and crannies and defects in the surface. It can only get so much out because it's too thick to get into these valleys in the surface, and it misses such a lot of bacteria, and it ends up just pushing the dirt around. On the other hand, with microfiber, the Violida microfiber products are roughly about a 1 micron, so much smaller in diameter, which allows the fibers to penetrate deep into the surfaces. And biofilms harboring bacteria, viruses, dirt and grease can be removed, and it sucks it up into the fibers using a capillary action, and it holds the dirt there away from the surface. And what does this do? It improves cleaning performance and reduces on chemicals. Most of our, with all of our microfiber is tested without using chemicals. It's only tested using water. And as I stated before, chemicals do not mechanically clean. They will only disinfect, and you need to clean before you can disinfect. So looking at some of the products to the Violida products to meet your requirements, there are 2 ways of using microfiber. You've got your single-use microfiber, which is what it says on the tin. You use it once and then throw it away. And it's probably the most effective solution for all areas, and in particular hygiene critical environments. We sell a lot of these cloths and mops into hospitals. Some use them everywhere throughout the entire site, and some will just use them for infected areas because they want to dispose of. Still have that effectiveness that microfiber has, like I spoke about in the last slide. And what do you get? You get up to 99.99% bacterial removal, and we back this up. And I say it's disposed of after single use. There's no storing of products required. You don't need a laundry process, or washing machines are not required on the site. Or we've got the other option, the much more environmentally friendly option of a durable microfiber, cost effective because it lasts so long. Environmentally friendly, as I said, because you're not disposing of all the time, and it's a much more environmentally friendly approach than other traditional methods. But again, you get 99.99% bacteria removal. You can store everything on your trolley after use, so your dirty cloths and mops can be stored on the trolley and then taken away for laundry. And most care homes have laundry, so this is probably the most effective way to use microfiber because it lasts such a long time. And as I say, you've got a management of the laundry process, but most of you are doing that anyway in the homes. But as I said before, it's much kinder to the environment. And our dedicated process helps you deliver your objectives. So what we do is we come and have a look at what you're currently using, assess what we think you require, doing a little bit of a site survey. We tailor make those products to suit your needs, your requirements. We have a number of different mops and cloths that are available depending on what sort of site you have. But we also have the trolley there. We have bespoke trolleys, which I'll come on to talk about. But we have customized on-site training and support packages, and we don't just put products in and just walk away. We will train. Violida, we're really big on training, and we'll tailor a training program, so that all your staff are fully conversed in how to use the system. And we offer that ongoing as well, so we can deliver that at certain points throughout the year and the years to come. So looking at cleaning trolleys, you saw the one that the home had earlier, and it's typical of I've found that care homes have these old trolleys that are pushed around, that are difficult to maneuver. So what can we do? We can offer you a bespoke trolley service. We can build the trolley with you. We have something called a configurator where we can build the trolley from scratch with your help to suit you. We know that sometimes your cleaning cupboards are really small, so you can have a smaller trolley, but it's secure. It's lockable from the sides and the top, and say fully lockable. So there's none of your residents trying to get chemicals off the top of the trolley. It's hygienic, easy to wipe down. So not loads of nooks and crannies. It's efficient. It's easy to push around, nice and light. It's on a swivel, so it's lovely to be able to push around. You can add other parts to it. So if you buy the trolleys in and you want to add something else to it, we can do that. But it's sustainable as well. We offer a 10-year guarantee with all our trolleys. But the main thing is that we can build those trolleys from scratch with you to suit your needs. So here are two of the microfiber mops that we offer. The top mop there is something called the Swept Duo Microcombi, which is a double-sided mop. It's a combination of microfiber get my teeth in, microfiber cut pile material and the microfiber fringes. And what this does on a hard surface, because it's got that fringes, it eliminates the need to do a pre-sweep or a vacuum on a hard surface. It will mop and pre-sweep at the same time. So it saves that time, that it's much more efficient. And what it will do is mechanically clean your floor before disinfection. And the mop has 1,000 wash durability. So again, as I mentioned earlier, you get 3 years of life for one mop. So it's a spend to save essential product, and it's also certified as the Honestein and Nordic Swan certification. The mop you can see underneath that is again a duo-sided safety mop, Duo Safety Plus. We can do these in 35 centimeter and 50 centimeter. But it's fantastic, this, because what it does, it has a scrub non-scratch scour on one side, which is fantastic for toilet floors. Most toilet floors are an Altro floor or a safety flooring, non-slip, but they're notoriously difficult to clean. So you can scrub your floor with one side, the polyester side, the scrub side of the mop. This will release the dirt to the surface. You flip that mop over and you take out that dirt, and it really works fantastic well and gets your floors really looking clean. And as I said before, safety floors are so difficult to keep clean. But it will mechanically clean your surface. Keep mentioning mechanically clean, but it's so important because these cheap non-wovens and cotton mops cannot do that. And as I say, 1,000 wash guarantee to give you 3 years of life. And again, it's got the certification to go with it. Going on to your durable cloths, we've got many to choose from. We're focusing here on the Micron Quick durable cloth, made from the finest microfibers, which is something called a Pi 32. Most microfibers will have something called a Pi 16, which basically tells you how thin the fibers are, but these are even thinner. They're double the thinness of normal microfibers. So it gives you an even better cleaning performance, and that will give you a 99.99% bacteria removal. And I'll come on to tell you about this, but very excitingly now, it will give you a 99.51 coronavirus removal, and that's certified by Independent Test Institute, which I'll tell you about in our next slides. But yeah, endless fibers for lint-free clean results. It'll wash 500 times. And again, you can be pre-prepped, so you're not double dipping into a bucket. You simply pre-dose the cloths, which will save chemicals, water and time. And everybody who's got mirrors or interior windows, it is fantastic for those sorts of surfaces. For glass, it's fantastic. And going to the next one down, we've got our single-use cloth, which is Micron Solo. Again, the only choice for hygiene critical environments. Again, made from the finest microfiber. It's tested by BMA Labor, one of our independent institute in Germany, and it's certified to remove 99.98% of bacteria, and also the same as the Micron Quick, it will remove 99.51% of coronavirus. And then underneath that, you've got micro and single-use mops. And again, these are used extensively throughout the NHS and in various care homes as well. And again, it's certified by BMA to remove 99.9% of bacteria on the surface. And I say it's got unrivaled microfiber mechanical cleaning performance and gives you 30% extra floor coverage against other single-use mops. And we also do this now in a double-sided version also. So the exciting news that we that was introduced this year was not only will the cloths and the mops remove bacteria, but it will also remove viruses. And we've never been able to say that before until we got independent test results back this year. Which has been absolutely fantastic. And I'll just ask the question, can you say that about the products you're using now? And please don't just think it's the chemical that does the work, because as I said before, your chemical will depend on whether you're using a cloth or a mop that has that quality microfiber to be able to reach down into those surfaces. So if it's not got the test data, then it probably can't do it. So this is what the Micron Quicker talked about, being able to remove 99.51% coronavirus. And that is tested just using water. We're not saying that, you know, your infection control people will probably say, no, we can't just use water. That's fine. But please use something that will actually mechanically clean. It's what I talked about earlier, mechanically cleaning the surface before you're able to sanitize. So yeah, I don't think there's any other cloths any company's cloth that have got that security of being able to remove the coronavirus. And also the Micron Solo cloths I mentioned before, again, the same independent test data for the removal of bacteria and viruses from surfaces, and again using just water. So as I said before, it doubles your protection. Even if you're using a disinfectant, you know, you need a cloth that can do the job, that can work mechanically clean on those surfaces. So important. Here's a little test that was done over at one of the hospitals in Amsterdam that uses, although we're thinking about using our Micron Solo cloths. If you look at the chair there in the picture, it was basically covered with a UV powder, which was just an easy to clean synthetic surface. And on one side, if you look at the right-hand picture, on one side of the chair, this is both after use, by the way. The chair split into two there, and on the left-hand side of that picture was used a cheap non-woven cloth, ready to use, pre-wetted with detergent. It had detergent with it as well. So you think you're doing a good job wiping over the surface with a cloth and detergent, but look what it left behind. It left almost everything behind. It pushed the dirt around, but didn't actually clean it. But if you look on the right-hand side, that was a Micron Solo cloth was used, and it's taken everything off that surface. And that's just one pass, one wipe with a single-use cloth, and only tap water was used. So I think that kind of just backs up what we're saying about the fact that if you're using chemical, which is fine, with a cheap non-woven cloth, it simply can't do the job. You're painting the surface and you're not mechanically cleaning it properly. So as I say, we back things up with what we say. You know, quality you can rely on and trust. All our test data, it's not what we've said or done. It's basically we use independent test laboratories, and you know that all our microfiber products are backed up by this independent testing. And the example include the Micron 1 Premium mops, Micron Solo wipes. We have the Nordic Swan certification, ISO certified production plants based in Europe, recycled certifications. So a fiber by any other name just isn't the same. And I said before, we offer ongoing training and support because we know staff change from time to time, get new staff in, so they might require further, you know, extra training. I mean, we've been supplying microfiber systems within healthcare sites since late 90s, early 2000s. And we've experienced of training in over 600 care home sites across Europe when we implemented microfiber into all our Corian sites across 3 or 4 countries. But we also offer a certified training program. So everybody we train will receive a personalized certificate. We do, I say, full on-site training. Or if you can't let anybody into the home at the moment, we can offer that training via our video link, which again is equally as good. This includes training up laundry staff. We give you wall charts on step-by-step guides on how to use the system, how to use the trolleys, trolley tags, so you can have the training on the trolley itself. And we also supply with an on-site logbook. So our relationship with you doesn't stop after the sale like many of the competition do. We're always here to help and deliver long-term training. And also, we're always switched on to support our website now. If you want to have a look at it, there are training videos on there on a lot of our products now. We offer QR codes on a lot of the products now, where you can just scan using a smartphone, and that will take you straight to a training video for that particular product. And that's open 24/7, 365 days per year. So even if we can't get to you, that training is still available. So now I'm going to pass over to our experts on iConnect. So just bear with us, and we just tell you about this management training support, which cuts out the need for any sort of paperwork and things like that. But Uma is the expert, and he'll tell you more about it. Thank you.
Thank you, John, for that wonderful presentation. Hi, everyone. My name's Uma, and I work for Leader Professional, but on the technical side of the business. So what I want to talk about today is our workforce latest innovation, a workforce management system called iConnect. So it's a cleaning management system that allows you to control all your processes in one location working remotely. So it's available on Android, Apple. You can get it on your mobile phone, and you can get it on tablets and pretty much most devices that are out there at the moment. So the main thing about iConnect, or what I want to talk about, is the way in which we can improve your care homes cleaning regimes. So what that means is whatever a cleaner does on a daily basis can be transferred onto a digital system, and the benefit of that is it reduces a lot of administrative tasks, and you can save a lot of money. Again, you can do this all working remotely. So if you imagine, you can have multiple cleaners across different care homes across the UK, and you can control and monitor exactly what they're doing, the tasks that are being completed. And with this system, you can save up to 15% of managerial costs. So cleaning regimes is one part of the function of iConnect, and we have a total of 9. So beginning with the first one, Paper-Free Pro, the first function, allows you to scan all your paperwork and store them on the system. So these are your paper forms that you have at the moment. So this could be your work order form, your risk assessment form, your holiday form for your employees. That can be transferred all onto digital. And the benefit of this is anyone can access it at any time, submit the form, and it would come to you as a PDF with signatures. The next module feature I want to talk about is File Pro. So with File Pro, you can manage and access your documents anytime, anywhere. The good thing about this is because it's GDPR compliant, you can have all your sensitive data on the servers, nothing stored on the phone itself, and you could have things like your cleaning plans uploaded onto the system, sensitive information like ID management, and it's really secure. The third function is called Task Pro. So this is where what I've talked about before, anything that a cleaner does on a daily basis can be programmed onto the systems. So you can set up weekly tasks, daily tasks, monthly tasks, as many tasks as you like. And what the cleaner does, she or he gets that task on the phone, and they can swipe right to complete the task. And that gives you that assurance that the task being completed, and you can access this remotely. Quality Pro is our auditing software. So we know sometimes that processes are unclear. And what this tool allows you to do is make your own processes standards using our software, and you can even share this result with your clients. The next feature is Fix It Pro. So Fix It Pro allows you to respond to complaints. Sometimes it's written down on paper or it's passed to the department, but maybe 2 weeks later when it's not relevant. So what Fix It Pro allows you to do is create tickets. So your cleaners could create tickets if they're low on supplies, anything damaged, etc. Or your customers if they want to complain about something. And again, if you can imagine that if multiple cleaners and you have multiple buildings for care homes, they can submit their complaints on phone, take a picture of it, and you would receive that email instantly. Allows you to deal with complaints and respond to them instantly, a lot faster. Next module is called Time Pro. So Time Pro is a basic module. It lets you give visibility on who is on site and when they've clocked onto that site. So they use a pin registration. So when they come in, start the day, they clock in, and then at the end of the day they clock out, and that information is in the cloud, and you can export that information onto an Excel sheet. So the next feature is Asset Pro. So Asset Pro gives you full visibility of your mops and your trolleys, what John was talking about before, with QR codes. So you can keep a full inventory of all your trolleys, all your valuable assets, and lets you know who's using it at the moment, if it's damaged, if there's a form that needs to be submitted with it, and it lets you keep an overview of all your valuable assets. The next feature is Automate Pro. So Automate Pro allows you to trigger notifications on your mobile phone with any of the above features. So let's say someone's cancelled a task and you want to know about it immediately, you can set this up on Automate Pro. Or let's say someone's put in a complaint and you want yourself and another colleague to be notified immediately. This can be set up to Automate Pro. So this allows you to get important information across faster via mobile phone and an email as well, which can be set up. And then finally, the Report Pro module. This allows you to create professional dashboards and share it with your clients. So with the above mentioned features, this can gather that data and put it into a professional dashboard. So an example I can give is Fixit Pro, which allows you to respond to complaints. So what the Report Pro would do would gather that information and put it into a bar chart. So then you would know each month how many complaints you're getting on the system. For Task Pro as well, Report Pro would gather that information and give you a percentage, a breakdown on how much when the task completed, and give you an overview of what's happening. Again, you can share this with your customers. And the best thing about these features is that you can start small and build them up. So you can pick and choose exactly what you want for your business. So now I want to talk about iConnect and how we've delivered a cleaning regime after post COVID-19. So we've introduced iConnect to our head office. So our cleaner, Karen, is currently using Task Pro. So we know that after COVID-19, a lot of her cleaning regimes changed. She had more tasks now. She has more tasks that require touch points. Now it's all been implemented onto a digital system, as you can see on the right-hand side, and she has no more written tasks on paper. So if you look at the right hand side on the screenshot, this is an example of what it would look like. So you have our building, head office Rochdale, you have the floors, and then you have the spaces, and within each space you would have your set of tasks. So what Karen does, she goes on the app and swipes right on the task that she's completed. So anything in green means that it's been completed, anything in yellow means that it's currently in progress, and anything in blue means that it hasn't been touched yet. It's a completely new task. So this is something that you would get and you could share to your clients. And our office manager, um, Tracy, is very pleased because now that she works at home, she can control everything, assign tasks all from home, and she can even receive tickets from our cleaner if there's any problems or if she's low on supplies. And we are pleased to announce that we have signed up a care home that's recently signed up with two modules, Task Pro and File Pro. So this allows them to assign tasks to cleaners, and File Pro allows them to upload cleaning instructions. And they've gone with 6 cleaners that are using the system and 1 team user. And again, you can pick and choose how many people you want to use the system for. So this has really helped their facility. So I want to thank everyone for listening, for taking part to join our webinar. If you have any questions about iConnect, or if you want a free one-to-one demo, please contact myself, or you could visit our website, vialeader-professional.co.uk. If you have any questions about the presentation that my colleague John presented earlier before about post-COVID-19, please contact him on john.wilson@FHP or your Vialeader regional or account manager. And again, if you want a copy of this presentation, please submit your email address in the chat box and we'll send one over to you. And I want to thank everyone for joining us today.